Hey, Kevin.
Hey,
Dr. Smith, nice to meet you.
nice to meet you too.
Why don't you come on back? All right. Oh, let me just take a look here, and yeah, there's some lunch. Okay. Yeah. Oh, one. And okay, good. Yep, that looks great. All right, Kevin, we're finished here. I'm going to take a look at your x-rays, and then we'll get you a treatment plan going, okay?
Okay.
All right, let me check what's going on Facebook. Oh, yeah, let me get my email, too. I'm late on another loan payment. I don't know how I'm going to afford this. The boss is mad, too. Oh, I got to make more money. What am I going to do? All right, Kevin, taking a look at your x-rays, I'm not really seeing any cavities, but, have you ever thought about ortho?
Well, what do you mean? I just had my braces a few years ago.
Yeah, well, I don't think your orthodontist did a very good job.
Oh, really?
Mm-hmm.
So what does that mean for me?
Well, I mean, we could probably align them a little bit better, and I think that that's going to save you a lot down the road. You're probably going to end up breaking all these teeth, and you're either going to have to crown them or get them pulled. So you might as well pay now for this than pay later for that.
Oh, okay. So do I need to see a specialist or?
Nope. Honestly, I'm practically a specialist as is. I do this stuff all the time.
Oh. All right, well, you're the doctor.
Oh, yeah. I'll take care of you.
Okay.
Give me a minute, okay? Oh, no. I haven't done an ortho case since dental school. Check something. Orthodontics for dummies. And, oh, here's a good video. Yeah.
Whoa. Let's stop it right there.
That looks like a pretty normal appointment from the patient's perspective, but what about the doctor?
Well, the doctor's behavior was just unethical. But sadly, situations like this, they happen all the time. Let's go back and look at a few instances. Perfect. Let's start it from this scene. After the dentist finished his exam, he decides to start checking his Facebook and email. He sees some emails with personal matters concerning money and is starting to get nervous. Focusing on outside matters will end up clouding the dentist's judgment in this case. Let's take a look at the specific ethical violations that end up occurring.
The first ethical violation is seen when the dentist decides to tell the patient they need orthodontics when they do not necessarily need the treatment. When telling the patient this, the dentist makes disparaging comments about prior orthodontic service that was not truthful, informed, and justified. He does this in order to serve his own interest to convince the patient to accept the treatment. Here we see justice being violated, and specifically Section 4C in the ADA Code of Ethics.
The next violation is seen when the dentist suggests that he is qualified and basically a specialist in this field. This violates the principle of veracity, specifically Sections 5H and 5I, that require you to announce specialization and limitations of the scope of practice. The way this dentist presented himself would easily confuse any patient.
The last violation comes when the dentist decides to not get a consultation and referral, despite the lack of knowledge demonstrated by his Google search for orthodontics for dummies. This violates the principle of nonmaleficence, specifically Code 2B, which states that it is the duty of the dentist to seek consultation and referral whenever the welfare of the patients will be safeguarded or advanced by utilizing those with special skills.
I think that was pretty educational.
Yeah, it was. While this scenario was slightly exaggerated, it's plain to see how easy it could be to violate one of these ethical principles, thus undermining the public's trust in our profession.
To make sure you're holding yourself accountable, brush up on the ADA Code of Ethics at ada.org/ethicsconduct.